Hold on, we
Hi.
may accidentally mute you. I don't even know how to work the volume on my computer.
Oh, that's one thing that we don't know how to do is technology. All right, so Dr. Christensen, I'm just going to let you know what is happening is we have a whole list of questions that we are going to go over. We have a lot of them. I think we have 20 questions. So we're going to try to get through as much as we can.
Allie manages things. Allie's a really good manager.
That's what I
And
do.
so she keeps us on track. She looks at the questions.
Yes,
It's her
yes,
job.
yes, yes, yes,
Yes.
yes. And then also, if I see some questions in the chat, I try to keep an eyeball on that too. So we'll try to get that to that as soon as we get to this.
Okay.
So, are you ready? Should we start our questions right away?
I'm
ready.
You ready?
Yes. Yeah.
So, will you officially introduce yourself? Tell us a little bit about your background, about your practice.
Okay, sure. So I'm a veterinarian. I've been a vet since 2002, graduated from Cornell in New York. I then went on to specialize in reproductive medicine, which is called Theriogenology. And that was at the University of Florida. And then I spent some time in private practice in Australia as a horse reproductive vet. And then I came back to the States. I was a professor at Iowa State University where I worked with both dogs and horses with reproductive medicine. And then I spent some time as a professor at UC Davis, about 5 years. Same thing, horses and dogs, reproductive medicine. And then I started my own private practice, stayed in California. I'm in the Sacramento area. And I started a practice called Kokopelli Veterinary Center. Kokopelli is a Native American god of fertility, so I thought that would be an appropriate um, inspiration or mascot for our practice. And so it's been about 8 or going on 9 years, I guess, that I've been running that practice. We have a nice campus in the Arden Arcade area of Sacramento. And most of my work now is with dogs. We do have some cat breeders that come to us, and we do still do some horse work. And my associate, Dr. Alyssa Shelby, she does a fair bit of farm animal work, reproduction in general. And we also offer general medicine services for dogs at our practice as well. But it's definitely the foundation still is the reproductive medicine. So we focus a lot on helping people who are breeders trying to breed the healthiest possible uh, puppies that they can. So we work a lot with health testing and um, genetic interpretation, and then we do all the things with frozen semen and pregnancy and C-sections and neonatal health, et cetera, et cetera. I have a couple kids, and one's in college, one's in high school, and yeah, that's a lot about me.
And one thing I want to say about your practice, even though you're in Sacramento, I've referred quite a few. Well, in our breeding program, moms that have retired, we're about 3.5 hours away from you, and we've gone to you for OSS because there's nobody in the area that does it, and then had no problem driving home with the dogs at a distance. So that's one thing I just want to say to people, because one of the questions, I don't know that I got it under our newest set of questions, but was there is such a challenge with finding veterinarians who do OSS. So I don't want people to hear that you're in Sacramento. Like, I feel like if you're in California, you're still a viable option for that, for an OSS if they don't have anybody in their area.
Yeah, that is one thing that we, among other things, that we have people drive sometimes pretty good distances to see us is the different spay and neuter options that we offer. I would say every week I talk to more than one client or potential client about their specific situation. We talk about the different options and try to come up with an answer as to which one makes the most sense for them and their situation.
And do you do phone call see, here we go. I'm already off script, but it's going to be fine. Do you do phone consults for anybody in California if they're considering what they're going to do for their dog?
Yeah. Yeah, we do. And we I've done phone consults for people outside of California as well, um, and help them to find veterinarians that are close to them. that might be able to help them with it since we wouldn't be an option for them.
Okay, so you guys when I post the recording of this, I'll be sure to include how you can contact Dr. Christensen and Kokopelli in case you want to take advantage of that, because I know that so many of you struggle with finding a veterinarian or at least just want to have an exploratory conversation. So, okay. Should we? I think since we're so far along, we actually probably should skip our lightning round questions.
Yes, which
It's
is a big bummer
10:15.
because we wanted to ask you some fun
Because there's
questions.
so much to get into here, and I
We do.
want to
We have
make sure
too
that
many.
we
Okay,
yeah.
let's crack on.
Okay.
Okay, I guess the first question is this.
Well, let's start with the terminology. Like, even just
Okay.
if you can just give a general overview of what spaying and neutering actually means. And then you have talked at length about the gonads and what they do in a dog's body beyond reproduction. So I'll let you just sort of riff off of that.
Yeah, spaying and neutering. So spaying is typically used for, well, it's always used for making a female. And I think we only really use this with small animals. We use different terms for large animals. So it's taking a small animal like a dog or a cat, female, and removing her reproductive organs or organs, I guess, at least surgically making them completely infertile. And it's by removing reproductive organs. And neutering is that same thing for males. So making them so that they are sterile surgically by removing something reproductively. Sometimes I've heard neutering used for females as well, but anyway, does that answer the question?
Yeah, and that's what I
Good.
kind of wanted to get at because I had heard that too. Um, and I think I think maybe what we'll do is we're just going to jump right into what the options are for each gender, just an overview, and then we can get into more specifics about the benefits and drawbacks of each. But maybe we can just start with males, what the options are.
Right. So options for males. Well, first of all, I would say we should start all of these by saying one option is to not neuter or spay, and then talk about why we would do that or not.
Yeah.
I'm going to let my dog inside because you're going to be a pain in the butt. Go inside.
See, even to
Here,
a
go inside.
veterinarian.
Okay. Yeah, they're excited that I'm here today and not at work. So for males, the options would be to do nothing and leave them intact. Or if you're going to neuter, then the traditional neuter would be to remove both testicles. A vasectomy is another option where you just remove a section of the vas deferens or the ductus deferens, which is the cord that connects the testicles to the penis, to the urethra, and delivers the sperms. And it's what a lot of men have done to them when that's the tube tying kind of thing for men. They don't just tie, they remove a section of it. So a vasectomy. And then there are some chemical options, hormonal or chemical options. There are options for actually injecting certain chemicals into the testicles, which destroys the tissue so they can't produce sperm. I have never used those, and they're really falling out of favor because there's just too many complications that can happen with those. But they have been out there. They do exist. Some people know about them and ask about them. And then there's a hormonal implant that we use actually a fair bit in dogs that basically causes a perpetual negative feedback loop on the testicles so that testosterone production completely shuts down to zero. So they're still intact, but without testosterone, they can't produce sperm. So they're
And that's
essentially sterile.
supralorin. Is that what that is?
Yeah, that's suprelorin, and it's reversible. So it only lasts for a period of time, 6 to 12 months, depending on which formulation you put in. And then if you don't renew it, put a new implant in, then it wears off.
Okay, so just go over that. Castration, then they are deprived of all hormones when they're castrated. But
Right. So
with
yeah,
vasectomy, they still have the benefit of their hormones.
right. Right. So with castration, the testicles are gone.
Yeah.
And that's the only source of testosterone is the testicles. So all of the effects of testosterone will be gone. And most of the effects of testosterone are good as far as the health of the animal is concerned. So muscle support and build, if you early on in life, during the growing stages of a young animal's life, of a male young animal's life, the testosterone plays an important role in how the bones grow and how the muscles develop. It has an effect on behavior. It has multiple effects on behavior, confidence, libido. Those things are all affected by testosterone. And so removing the testosterone does have an effect on those things. The
Hmm.
drive to work and get out and do things is driven by testosterone as well. Yeah. So castration completely removes that. Vasectomy, all vasectomy does is prevent sperm from being delivered to the penis. And so whatever sperm is produced just degenerates inside the epididymis, which is the tubes right outside the testicles.
Okay.
And so the animal is rendered completely infertile, but all the testosterone is still available. So all the other benefits of testosterone, besides being fertile, are still there. So that would include all of the growth things, all of the behavior things, all of the metabolic things as far as not gaining weight as easily and being more driven. Also, cognitive issues are related to
Hmm.
testosterone. So, um, there's been studies to show that neutered dogs have a faster cognitive decline than intact dogs do.
Hmm.
Interesting. Okay. And what about what is the current understanding about the aggression?
There's a lot of stuff about behavior that we don't fully understand, and it's a difficult discipline to study because so much of it is subjective evaluation. You know, what do you think's happening? They're harder, those things are harder to measure than things that you can put a number on. And so behavioral studies are notoriously difficult to interpret and have people disagreeing about the findings. Having said that, the the one thing that seems to be relatively consistent with regard to behavior and aggression and neutering is that intramale aggression tends to go down with neutering.
It's actually one of the
That's one of the
that's one
questions.
what does it
Yeah.
say about the impact of neutering on
Yeah.
behavior?
Just so I'm making sure that I understand correctly, it's true that male on male aggression declines if they're neutered dogs.
There are some studies that seem to support that with statistical significance. So,
Okay.
yes, that does seem to be true.
Okay. And as far as like the benefits that you're talking about, well, cognitive obviously is lifetime, but is there a point at which a male dog has gained, like, the growth plates have closed or they've reached full maturity? Is there a point where you say, okay, we know that they've received the benefits of growing with testosterone and it would be what people are asking is what's an age where it's okay to neuter if they've chosen to
Or
neuter?
what's an age should get a vasectomy? Like, both of
Oh,
those questions are on here too.
Well, so those are two different answers. If you've decided that you're going to do a vasectomy, you can do it at any age. It doesn't matter because you're not touching the testosterone.
Mm.
So you could do a vasectomy on a prepubertal dog and it would have zero effect on their growth or anything regarding health. It would have zero effect on health. Um, Neutering is a different story because then you are removing those testicles that are producing the testosterone. So for that, mm, I'm glad to see that many more vets are now getting more on board with both males and females suggesting that they at least reach full growth before you spay or neuter. So with a male dog, it would depend on if it was a large breed or a small breed, because they large breeds take longer to reach full growth than small breeds do. But for a large breed dog like a golden retriever, I would say 18 months minimum.
And
Uh,
okay. I'm hyperlinking. If there's a retained testicle, does that recommendation change?
for me, it doesn't, because the reasons to remove a retained testicle, or the term that we use in medicine is cryptorchid, so retained testicle or cryptorchid testicle, is that they have a higher incidence of cancer, testicular cancer, and there is a higher rate of torsion or twisting.
Mm,
The cancer's the bigger risk, but both of those are risks. The cancer of the testicles in dogs is almost always benign, so it's not an aggressive cancer usually, almost never. But the problem with it when it's a retained testicle is that you don't see that it's growing. You don't see the tumor because it's inside the dog's body.
mm,
Whereas if you had an intact male with both testicles down in the scrotum like they're supposed to be, and that dog were to get testicular cancer, well, you'd notice it because you'd see that the scrotum's getting bigger than it had been, and one side's bigger than the other side. But if it's inside the abdomen, you don't see that, and so it could grow and grow and grow, and just by virtue of its size and growth, it could cause some problems, even if it's not um, actually metastasizing anywhere in the body.
okay.
So you do want to take it out, but the likelihood of a dog getting cancer before 2 years of age is low, very low. And when you're weighing that against the risks that you have by neutering early, which you will affect growth, you will put that dog at a much higher risk of orthopedic problems later on in life, like hip dysplasia and elbow dysplasia and cruciate disease. And in some breeds, you'll put them at a higher risk of cancers that are metastatic and malignant, like lymphosarcoma and osteosarcoma and um, hemangiosarcoma and mast cell tumors in some breeds, and Goldens are one of those breeds.
Yeah.
So when you're weighing all of those things, if I have a dog like a golden retriever, really any dog that's cryptorchid, I tell them let the dog reach full growth, then have it neutered.
Okay. And do you recommend in that case leaving? Well, I'm just going to ask the question because you said at the beginning, the first question is, should you even desex? So in the case of males, Goldens, um, is there a compelling reason to neuter them if somebody can keep their dog intact, if they're not having any?
I don't think so.
Mm,
I don't think so. If you don't have intact females in your household or in your circle, friends that you're commonly hanging out with, letting your dogs mingle and play with, if there aren't intact females in that sphere where an accidental pregnancy is a concern, then there's no good, in my opinion. I can't see why you would want to neuter for health reasons.
mhm,
Um, because the only health concern that you have by leaving the dog intact is that the prostate will continue to grow. And most dogs with enlarged prostates don't have any symptoms, don't have any problems with it. And if they do, they're usually approaching 5+ years. That symptom usually is blood coming from the prostate. And if it's a breeding dog, then you'd usually see that in the semen when you collected semen for artificial insemination or freezing or shipping or something. But if it's a non-breeding dog, you might just notice it in the urine because prostatic fluid is expressed in the urine as well. And so you'd say, oh, there's some pink to the urine. You might think, oh, there's a urinary tract infection. If it's an intact male, it's probably more likely that an older intact male that it's going to be bleeding from the prostate. But that is so treatable with inexpensive medication, finasteride, the same drug that men take for enlarged prostates, shrinks the prostate down without affecting testosterone. It doesn't have any side effects. It's a great drug, and it's inexpensive.
Right,
So
and I'll say I've heard people tell me that their vets have told them that the risk of leaving them intact is exactly that, is an enlarged prostate, and also a risk of increased cancer. But I do just want, and I want you to comment on that, but I will say, both Moses and now Rufus, who's 8.5, have been on finasteride. Is that how I pronounce it? And it has been, I mean, you've given it to him. It's
A
very
million
easy.
times.
Yeah, it's very easy and no side effects and has completely managed it. So I just want people to know that's something that I've personally done with our males and been really happy with what it's done for them. So, but can you speak to the concern that they would be at risk in an increased risk for testicular cancer or
yes, of course, they're at an increased risk for testicular cancer because if you have no testicles, there's zero risk of testicular cancer.
That's so true.
So, so yes, it's an increased risk. But as I've said already, testicular cancer is almost always a benign cancer in dogs. It rarely, I have never, uh, the only case that I know of that's been reported, which might have been spread, was from one testicle to the other. I'm not aware of a case. There may be one out there, but if it is, it's exceedingly rare of a case where testicular cancer has spread elsewhere in the body and been a health threat.
Hmm.
So, so testicular cancer in dogs is about as nice a cancer as you could hope to have, maybe just second to like the lipomas, those fatty tumors, because it just doesn't spread and you see it because it's they're in the scrotum, you see the testicles growing, and so then you say, why is this happening? And you take your dog to the vet and they do an ultrasound and go, yep, looks like there's a tumor there, and then you take it out and then it's cured. So that as a reason for preemptively taking the testicles out of a dog early in life, to me seems like a ridiculous reason, because there's no reason to put a dog through that and put it at risk of the other health risks, which we've talked about, to avoid a risk that is not really a big deal anyway.
Mm-hmm.
So I just really don't think that's a good reason. And I'm convinced, I mean, I've written some blog posts about this, that this all stems from our desire to see less stray dogs and cats um, euthanized in shelters. And so we feel awful about that, and we think, what can we do about it? We say, well, obviously, if dogs are spayed and neutered, they can't have puppies that will end up in the shelter. So that's what a responsible pet owner should do: is spay and neuter their pet. And that's all well and good, except so many of our pets are not contributing to that population if we're doing the right things with them otherwise, which is keeping them contained, not letting them roam free. There's so many other problems with letting your dogs and cats roam free, with getting hit by cars and getting exposed to wildlife and other stray animals and diseases and fights and just lots of reasons to not let your dogs and cats just wander free. So if you're doing the right thing anyway, your animals are not contributing to the overpopulation of pets in shelters that are being euthanized. But we wanted to do something, and this was something we felt we could do. And so this became a push and it became a crusade. And I think crusade's a good word for it, because I think people have almost religious like feelings about it. They love their animals, and if you love an animal, then this is what you do. And anyway, I could go on and on about that,
Yeah.
but the bottom line is that there really isn't a good medical reason to do it, and I don't even think there's a good social reason to do it if you're doing the right thing otherwise with your pets, which is keeping them under control. And then I will say one more thing about cancer, because sometimes people will hear that prostate cancer is a reason for neutering your male, and that is exactly wrong. If you've heard that, if somebody's told you that, even if it's your vet, it's not true. The studies that have been done have shown that there's actually a higher risk of prostate cancer in neutered animals than intact animals. Now, it's low for both, so I also wouldn't go out there and say you need to keep all dogs intact, otherwise you're going to get prostate cancer, because luckily that cancer rate is low for both groups, but it is higher in neutered males than intact males. And that is a nasty cancer. That is a malignant, aggressive cancer that will end the life of the dog.
Okay, we have so much to get into with females, but I do want to ask you to comment on because the downstream consequences of being neutered on weight and what's the word that I'm looking for? Metabolic efficiency. I couldn't remember the phrase, but if you can speak to that, I think that, I want to make sure that everybody understands that these hormones do more than contribute to reproduction.
Yeah, they do. Most hormones have multiple jobs in the body, and they may have a job that they're better known for, but they also do other things. And in the case of the reproductive hormones, with like testosterone, estrogen, progesterone, we think of them in their reproductive roles of in the females supporting pregnancy and cycling, and in the males producing sperm and male secondary characteristics like muscle growth. And those things are all true, but they also have other effects. And that's why we talked about cognitive issues in male dogs being more quickly degenerative if they're neutered. Testosterone has a function in the brain to support cognitive function in males. And so that's one thing. The metabolic issues that you're asking about, for both males and females, the reproductive hormones help the body more efficiently metabolize nutrients and sugars. And so when you remove those hormones, the body has a harder time metabolizing fat and it accumulates it instead. And your drive to work and move and is dampened. And so it's been well known with dog owners and cat owners for decades and decades that when an animal is spayed or neutered, the tendency to gain weight goes up and their energy levels go down. And those two things work in together, unfortunately, to cause weight gain. Now, those things can be countered with good diets and good exercise, but it's a reality and it does make it harder to do. So that's something that people have to think about. People that work with working dogs have long been of the opinion that they don't recommend spaying or neutering those animals because they've noticed with all of the animals they work with that when you spay or neuter a dog, they're not as effective in their job.
Yeah.
I have a my dog's half border collie, half Queensland healer, and he was neutered long before any of this knowledge was out
Yeah.
there. But he's I always say he's kind of he's a bit of a slug. I'm the only thing that he herds. So
And there are exceptions. There are dogs out there that are spayed or neutered that are great athletes and in great shape. We see them, but
no.
Now we have to speed talk because this
Okay,
is the big thing
back
that,
on track.
everyone has really big questions about OSS and all that stuff. So it's for females, like as basically as possible, what are the options for spaying a female?
okay, so once again, not spaying is option number one. Option number two is to do a traditional spay, which a traditional spay is what vets have been doing in the United States for decades, and that is going and removing both the ovaries and the uterus. And I'll just one small point there, because this will come up in a minute, is when vets do that, they remove both ovaries in their entirety and they remove the uterus almost in its entirety. They leave a little bit of uterus right in front of the cervix. And the reason they do that is because the cervix is a very muscular, thick organ and harder to close and put suture material through than the uterus is, which is much thinner and easier to close. And so they'll leave a little bit of uterus in front of the cervix, and that's what they close. And it's not a big deal. They're not at risk for pyometra because if you remove the ovaries, pyometra is not going to happen. So a properly spayed female with a traditional spay will not get a stump pyometra. If the ovaries are completely removed, she won't. Okay, so that's traditional. That's number two. The third option is the ovary sparing spay, the OSS, and that is also, you could also call that a hysterectomy because what that is removing the uterus, leaving the ovaries. And then the fourth option is the opposite of that. It's an ovariectomy, which is removing ovaries and leaving the uterus intact. And both of those latter two surgeries can be done with a laparoscope, although there aren't very many places that do the hysterectomy or the ovary sparing spay with a laparoscope. There's some, and there are more that will do the removing the ovaries with a laparoscope. And so that's a nice option if you go that route, because then you can do two tiny little incisions with very little blood loss, very little pain, and quick recovery, few days recovery instead of a couple weeks. So, why would you not choose option one and just leave the uterus well, if you're breeding, then of course you would. But if you're not breeding, why would you leave the uterus? And my opinion is that there are good reasons for doing some kind of a procedure and not leaving a female intact if you're not breeding, because the risk of a pyometra, which is uterine infection, is quite high in intact females, especially those that aren't breeding, and quite high, according to some studies, is between 25 and 50% depending on the breed. Meaning, if you leave your female intact for her whole life, there's a 25 to 50% chance at some point she's going to get a uterine infection. And that's a serious infection. It can be life-threatening if it's not treated. It makes them feel awful, and it can kill them.
And it can
So
be undetectable for a, an initial period if it's right. Some of them can be. So you wouldn't even know that she was developing it.
right, it can be open or closed, and that's if the cervix is tight, closed, or open. And if it's open, generally they're not as sick, and you'll notice it probably because they have a nasty, yucky pus-like discharge coming out of their vulva. If it's closed, you won't see that discharge, and after they've had that for a while, they'll start to get sick because of all that pus building up inside their uterus, and often it's releasing toxins into the blood. So it can be quite a serious condition. And so, in my opinion, I think that leaving a female intact if you don't plan on breeding her is not a wise decision. There are other countries, especially like some Nordic, Scandinavian countries, that are of a different opinion and have made it illegal to do any kind of elective surgery at all on dogs, and they consider this elective. And those are the countries we're getting these statistics from, of the 25 to 50% of dogs in their population. Female dogs are getting pyometras. So it's a choice they make. So I don't think it's a great way to go. So then that brings us to the next options. I don't think that a traditional spay needs to be done, because you don't need to remove both ovaries and uterus to accomplish the goal of, number one, making sure they can't have an accidental pregnancy, and number two, making sure they don't get a pyometra. If you just remove one or the other, ovaries or uterus, and not both, it accomplishes both of those goals. So why do you need to remove both? You don't. I mean, you can, but you don't need to. So then we come on to the final two choices, which are ovary sparing spay and leaving the ovaries and taking the uterus out. Hysterect, or
And
sorry,
just to
I meant the
clarify,
opposite. Ovary
yeah,
sparing spay, leaving the ovaries, taking the uterus out, and then the opposite, taking the ovaries, leaving the uterus. And so the difference between those is, do you want her to continue to have exposure to the reproductive hormones, estrogen, progesterone? And if you leave the ovaries in and take the uterus out, she can't get pregnant, she can't get a pyometra, and she'll have access to her hormones. That's a good decision if you're dealing with a dog, especially, that needs access to those hormones because they're at higher health risk if you remove them, and you don't have an intact male around. Because if you leave the ovaries, if you do an ovary sparing spay, they will continue to cycle. And you won't notice it as easily because they won't bleed, because the bleeding's coming from the uterus, and you remove the uterus when you do this surgery. And you should remove all of the uterus. So different from the traditional spay where they leave that little bit of uterus in front of the cervix. If you do an ovary sparing spay, you have to take the whole uterus out. Since you're leaving the ovaries, if you leave that little stump of a uterus in front of the cervix, she's at risk of getting a stump pyometra, which can make her as sick as a regular pyometra. So if you have a vet who's doing the ovary sparing spay, they have to go down and actually take part or all of the cervix out to make sure all of the uterus is gone. And then that dog will continue to cycle. You won't see bleeding because that would come from the uterus, and the uterus is gone. But the
and
behaviors, go ahead.
I just wanted on that the comment of the stump pyometra. What you had said to me um, a couple years ago when we talked about this was that if there's a stump pyometra, that's not something that could happen unexpectedly. That's an error in the surgery.
Right, because the right way to do an ovary sparing spay is to remove all of the uterus. If if you leave part of the uterus, you did the surgery incorrectly.
Okay.
And so, um, yeah, they will still go into heat. They won't bleed, but the vulva will swell. With a golden retriever, you might not notice that because they're so fluffy, but the behaviors will change. And so any behaviors that that female had going into heat before, she'll still have because she's still going to have all those hormonal influences. And male dogs will still cue in on that, even though there's no discharge, at least no bloody discharge. There's still the behaviors, there's still pheromones, there's still some smells coming from the vagina that will cue them in. And so they'll still be interested in breeding and she'll still be receptive. And if they're allowed to breed, there's nowhere for that sperm to go. When they tie, when they get that copulatory tie and they're locked together, he's ejaculating and there's nowhere for that sperm to go because the vagina ends blindly in scar tissue. And the penis is going to fill up most of that and then all of the ejaculate. So there's going to be a lot of pressure. And you could have a case where the scar tissue fails and the semen gets into the abdomen and now she's got a raging peritonitis, which is a surgical emergency.
Yeah.
So I give pretty strong warnings to people that want to do ovary sparing spays to make sure that they know that they need to keep their female essentially away from intact males. And if that's easy
And
for
she's
them, it's a great surgery.
okay, and that's only when she's in season,
Right.
and that
Right.
only occurs how often?
Twice a year maybe.
At most. Okay.
Yeah.
And one thing I want to comment on because I think that people think that if a male gets near a female in season, you better look out because they could be tied, like turn your back and it's going to happen. And at least in my experience, that is not the way it goes.
It
But
can.
okay, it can.
In
I
my
understand it
experience, it
can.
can.
Okay,
We
okay.
definitely
And it can't. I had one litter where I was like, oh my gosh, they tied so fast. But all I'm saying is this goes back to the idea of being a dog guardian who is really paying attention to your dog. You're not going to be leaving your dog who's in season in the yard by themselves, right? Like you're going to be careful and have responsibility as an owner so that to make sure that this doesn't happen what you've just described.
right.
And
No,
I'm
I think
only
I'm a fan of the procedure. I think that I just want people to understand that I'm with you. Sometimes I talk to people like, oh, what could, the dog's going to jump the fence and come flying over it. And, if in your normal life, you're not around intact males, the risk of this happening is so low.
and how
But
many days is a female receptive to a male? I mean, because she won't allow him to breed if she isn't at a certain point in her cycle. What I want people to understand is we're talking about in a year of a female who has an
maybe
OSS.
10 days, maybe 5 days
Yeah.
each cycle.
Yes.
Yeah.
This is not
But
a huge amount of time.
no, it's not a huge amount of time. But if you live with intact males,
Oh, yeah.
it can be hard to know when she's coming in and catch that sometimes. So each client, each pet owner, guardian needs to ask themselves, how good am I at detecting this? And if I'm relying on seeing little red drops on the floor,
Yeah.
that's not going to happen.
Yeah.
So if I can tell because her behavior is changing and I'm checking the vulva and it's swelling, then and if you had any doubts, you could run progesterone, you could do a vaginal cytology, the same things that we do in females we're trying to breed and determine if she's coming in. So there are steps you can take to try to find out if she's in heat or not. You just have to have that in your head and be looking out for that.
Can a male who has been neutered still breed?
They I've heard of sometimes that happening. It's pretty rare. And
Okay.
there's no sperm. It's just
Yeah.
prostate. And if you had neutered males in your house, then I would not be concerned about having a female with an ovary sparing spay done. I don't have any concerns about that. If you have a vasectomized male, I still have concerns because he's still going to breed. There's no sperm, but there is prostatic fluid.
Mm,
And that's the most volume in the ejaculate is coming from the prostate anyway. So there would still be a risk with a
okay.
vasectomized male and an ovary sparing spayed female.
And why do you my understanding is that you typically, have a female go through one cycle before doing an OSS, is that correct?
Yeah, and part of it is the same reasons for the male, that the female hormones also play a role in growth. And if you remove those before that female has gone through full growth, then she is also at risk of having things like hip dysplasia, elbow dysplasia, cruciate disease later on in life. And these are all large breed dogs. So
Yeah.
the studies that have shown these orthopedic concerns were with dogs that their cutoff was like 45, 47 pounds, somewhere in that range and higher. So for medium and especially small breed dogs, they haven't shown an increase in orthopedic problems later on in life. They usually don't have orthopedic problems except for patella luxation, and that doesn't seem to be linked to any of this. So far, we haven't found a link. So that's the concern with the females, but also there's some growth with their reproductive tract, so their vulva. And
Oh.
many females have what's called like a tucked or hidden or juvenile type vulva or hooded vulva,
Is that a
whereas this
recess? The same as recessed?
recessed vulva, yeah,
Okay.
all of those terms mean the same thing, of the vulva that instead of being facing backwards right underneath, an inch or so underneath the anus, is tucked up between the hind limbs, and covered by often a fold of skin or fatty tissue. And that those females with that anatomy are at higher risk of recurring urinary tract infections. And sometimes it can be quite debilitating because they're just always getting these infections and they clear up with antibiotics, but then they come right back when they're off the antibiotics. I've seen some females that their vulva is so fibrous and scarred because of these always having infected urine, and inflamed tissue back there. And it's because they were spayed early and they weren't allowed to go through puberty and have that maturation of the female reproductive tract, and in this case, the external reproductive organs. So that's a big reason for letting them go through one cycle, let them reach their full growth internally, externally, bones, muscles, soft tissue, vulva, everything before you decide to spay them.
Okay. And can you speak to I mean, Goldens, I wanna talk about Goldens specifically. Um, what is it about a golden retriever? Wasava had that chart, I'm sure you saw it come out about, like, there were 2 breeds that they said unfortunately, they worded it as "leave intact," which then brings up the whole pyometra issue. But what is it about Goldens? Why are the reproductive hormones so important for them?
Well, it seems that Goldens, well, we know this is true, that Goldens are at a higher risk for some pretty bad cancers than other breeds. All the ones I listed before, the lymphosarcoma, hemangiosarcoma, mast cell tumors, and to some degree, osteosarcoma. All of those are aggressive, malignant cancers. They're all internal, and so you often don't catch them until they're more advanced and are starting to show clinical signs or symptoms, and by then they've spread. So it can be devastating. And cancer, just really basically, cancer doesn't happen because of one gene mutation. There have to be multiple mutations in different genes because the body has a lot of checks and balances to keep cancer from happening. And those are checks and balances on growth. Cancer is unrestricted growth of cells, cells that just grow and grow and grow and grow. And that's why it's a tumor. And so the body has a lot of different checks and balances that check cell growth. Cells have to grow, cells have to divide. That's how we function and grow and live and as organisms. But it has to be at a certain rate that's just right for whatever tissue that is dividing. And what cancer happens when those checks and balances are compromised, when all of them are compromised. And some animals, people, dogs, whatever, are born with some mutations already from their parents. They inherit these mutations that maybe knock out one of those checks or balances on cell growth. And you're already born with that. And then other things happen in life that cause mutations, and as they stack up, if the wrong mutations stack up, then all of the checks and balances are gone in whatever tissue of the body we're talking about, and they grow. My family is prone to skin cancer. We're born with some mutations already. We're fair skinned, and that doesn't help. And so we're born with some of these mutations, and then we get out in the sun and get some radiation from the sun, and that causes more mutations in our skin. And we will develop cancer a lot faster than another family that doesn't have those initial mutations, because we're already at a head start toward cancer when we're born. Golden retrievers and other breeds are born with some mutations that are already predisposing them on the pathway to getting those cancers. And then when you spay or neuter them early, you cause them to have a continual, we think that this is the reason that they're more likely, is because then they have a continual exposure to LH, luteinizing hormone, which in an intact female and male will only be there periodically, especially females. They only have exposure to LH twice a year right before they ovulate. It causes ovulation. Otherwise, it's pretty much baseline. But when you spay a female and take those ovaries out, that negative feedback to the brain to tell LH to stay shut off, except for those 2 times a year when she needs to ovulate, is gone. And so the brain just starts secreting LH all the time, every day. And as we said at the beginning of this conversation, hormones have more than one function. And LH doesn't just cause ovulation, it does other things. It's a growth hormone. And so now the females are exposed to this growth hormone all the time. And that takes an animal that's already predisposed to cancer, which is indiscriminate growth, and pushes them over the edge.
Mm.
And they're at much higher risk of getting those cancers when they, and again, this is the leading theory, and there's some evidence behind it, and we're going to be learning more, but the leading theory now is that's why. We know that there's a correlation. We think this is the cause, and we think that's why.
Okay, and so first off, I think,
We're really close, and there is.
but is it okay if we go over? Do you have another like 15 minutes?
Yeah, I have time.
Okay.
And we should make sure that I just say a few words about the ovariectomy, the taking the ovaries out.
That's what I was going to
Because,
ask. Someone,
yeah,
people
so
are
that,
asking.
right. So that then is the exact opposite of the ovary sparing spay. In that case, we take the ovaries out and leave the uterus. And if you do that, the uterus atrophies. It just becomes inactive and kind of shrivels up. It just becomes this tiny little inactive organ. The uterus itself doesn't secrete any hormones. It just reacts to hormones. So when you remove the ovaries, the uterus will become inactive, and it will not get infected. It will not get a cancer. It won't do anything. So you don't need to remove the uterus if you're going to remove the ovaries. And so even if you don't do it with laparoscopy, even if you just go in and do a traditional surgery where you open up the abdomen and go in, you can do a smaller incision, and it's much less tissue that you're taking out. So the risks of bleeding and postoperative complications are lower anyway with just a traditional ovariectomy. And then if you go one step farther and do the laparoscopic, then you have little bleeding, little to no bleeding, little to no pain, very quick recovery. If you do that, then you still have all of the potential negative consequences of a traditional spay, which removes the ovaries also. And so decreased metabolism will be a likelihood. There's a small risk of incontinence with spaying. And whether you do a traditional spay or an ovariectomy, you're removing the hormones. And so that risk is there, which is not there with the ovary sparing spay. But you don't have the risk of accidental breeding because they won't cycle anymore. So you don't have to worry about intact males being around them. And that's probably the big advantage of that one.
Pyometra is still on the table, though.
Pyometra is not. No, there will be no pyometra. If the ovaries aren't there, pyometra won't happen because the uterus becomes inactive. And the reason pyometra happens is because of hormone stimulation from the ovaries.
Okay.
So that's gone. It won't happen.
Can you talk about The risk, if you do an OSS, the risk of mammary cancer, and also um, you gave some backstory on the study about mammary cancer. This was several years ago now. I don't know if you remember that.
Yeah, I remember.
Okay.
Yeah, that study. So there was a study done in the late 1960s that reported, at least as it was interpreted, reported really big jumps in risk of mammary cancer the longer you waited to spay a female. And I might misquote the numbers, but they're in the ballpark of, if you spay before the first heat, then you have the lowest risk of mammary cancer. But if you wait until after the first heat and spay then you increase it by like 5%. And if you wait, and again, these numbers might be a little off, but they're in the ballpark. If you wait till after the second heat, then the risk goes up by like to 15%. And if you wait till after the third heat to spay, then it's like a 26% increase in risk of getting mammary cancer. And after that, it's just high, and you don't get any benefit. So you got to spay them early, and best if you spay them before they have their first heat. That was the interpretation of the paper. And it was interpreted that way not by the people who wrote it. That wasn't their findings at all. They just published the paper, and then people who read it interpreted it that way, and it got written up in a textbook, and then everybody starts spewing that off again and again as gospel. But if you go back and look at the paper, it and this is important. It seems a bit subtle, but it's important. What they found was that those percentages, they weren't a lifetime percentage chance of getting mammary cancer. They were that you had that percent chance of what an intact female would have if she were left intact her whole life. So, to put it in other words, we don't know exactly what the risk of mammary cancer is if you just leave a female intact her whole life. But let's just put a number on it and say that, and I think this is a reasonable number because I have lots of intact females in my practice and very little mammary cancer. So let's just make it a bigger number than what I think it is and say it's 10%. And I think that's an exaggeration. I don't think there's a 10% chance of a female getting mammary cancer, but it might be close. So it's an easy number, 10%. Well, what this study says then is, if the risk of a female getting mammary cancer in her life is 10%, if you leave her intact, then if you wait all the way past her third heat cycle before you neuter her, she has a 26% chance of 10%. So that's a 2.6% chance of getting mammary cancer if you spay her after her third heat instead of letting her stay intact her whole life. And if you spay her after her first heat, 5%, it's a 5% chance of 10%. So that's 0.5% chance of getting mammary cancer if you let her have her first heat and then spay her, which is a hell of a lot different than, like, 0.5% is a hell of a lot different than 5%.
Yeah.
So yeah, it it's been misquoted and it's been repeated over and over again. It's probably taught when I was in vet school, and even up maybe even now, it's still taught that way to vet students. So they all graduate thinking that if you don't spay a female before her third heat, then she's got a 1 in 4 chance of getting mammary cancer in her life. And it's like she's got a 2 in 100 chance of getting mammary cancer in her life.
I
If you
hear this
spay her
back
after.
so much with the puppies I send home. I can't begin to tell you. I mean,
Yeah.
this is one big counter argument from vets who, when they're asked to do an OSS, cite this concern. Even if, let's just talk about mammary cancer versus hemangiosarcoma.
Right. And just, I've talked to oncologists who are, their whole lives they've been taught this, and even as oncologists they have misquoted this study. And so it's hard for them to revisit it and come to terms with that. But even them looking at this will say, if you've got a choice between a high risk for mammary cancer and a high risk for hemangiosarcoma, oh my gosh, you're going to choose the high risk for mammary cancer any day of the week, because you can see that coming on. give your dog a belly rub a few times a week and feel her mammary chain, and you can feel a little mass-like thing growing in there. And if you feel that, then you take her to the vet and the vet feels it. And if they have any concerns, it's a pretty simple surgery to take that out. And about half of mammary tumors are benign. They're not metastatic. They're not, and so taking it out, even if it was a benign cancer, cures it. That's not true of hemangiosarcoma. It's not true of lymphosarcoma. It's not true of mast cell tumors. So I would 100 times over choose to be watching out for mammary tumors over any of those other cancers.
Okay. That's yeah.
Mm.
Yeah. That's
What
oh,
about hormones? That's
well,
good. That's something
let's
that
ask.
that's
I want to I just want to drill down because I do hear back. I get so much pushback on OSS, and it's surprising to me how much pushback comes from the veterinarians of puppies I've sent home. And I would say it comes in two forms. One is the mammary cancer concern, and the other is that they can have a healthy life and healthy lifestyle, and that the concern about the bad cancers in Goldens are inflated. So, I mean, I would love to, I want to use it. I really want to post a clip. So I'll give that to you as a little disclaimer. I would love for you to speak about the research
mm.
on female Goldens in particular and the risks of cancer when they are deprived of their ovaries after their first heat cycle.
Yeah, there have been quite a number of papers that have come out showing that there is a correlation between early spays and increased risk of cancers, especially in female Goldens. And those were largely out of UC Davis. The Harts, H-A-R-T, are the two scientists that published most of those. Now, there was another study that came out of UC Davis just a few years back out of the oncology department that I don't know if I want to say it countered that, but it wanted to maybe temper the message that was coming out. And the message of that study um, out of the oncology department, just my interpretation of it, and I've spoken to the authors. In fact, the one of the lead authors is a classmate of mine from Cornell, a friend of mine, and we talked about it. And his big message from that was to not forget that age is a huge risk factor in any dog or any organism and cancer. The older you are, the higher risk you are of having accumulated more mutations and getting cancer. Cancer in children or young animals is rare, especially compared to older people or older animals. And they wanted to go back and look at a similar data set and show that age was a huge factor in getting cancer. And it doesn't mean that spaying is not a risk factor. They just didn't want it to be exaggerated. So, in all fairness, there are those different studies coming out and saying, let's not run crazy. Let's step back and try to think about all of this scientifically and take these animals as a whole organism and consider all the risk factors. So I certainly acknowledge that. But having said that, I think that the data from the Hart's laboratory is pretty convincing, um, especially the difference in breeds, which isn't surprising. We know that different breeds have different predilections for different health issues, cancer being absolutely one of them. And anybody that knows anything about dog breeds knows that there are different health issues that will show up, and it's just basic genetics 101.
Mm.
So the unfortunate thing about the health of Goldens is they're born with some increased risk of cancers. And the spayed population is showing it higher than the intact population. So um It's definitely a hot topic. There's definitely other people looking into it, and more will be known as other studies come out. Um, there's a lot of work being done up at Oregon State University with Michelle Kutzler's lab looking, and she's one of the ones who's really digging into this LH mechanism to see if that is what's causing it.
Okay. Do you wanna are there a couple questions we could at least, like
There's one that talks about hormone replacement. I've been seeing that a lot in the chat, and it's in our notes. What do you have any suggestions? Is that an option? Is it for whom? That type of.
Yeah. Well, so for males, you can do testosterone replacement. Um, yeah, we've done that with a few patients, and that can be done. If you have a dog that was neutered early and you regret it or wonder if you can help with some testosterone replacement, there are options for that. With females, it's not as simple as just giving estrogen and progesterone. We don't have that dialed in
mm,
nearly as well. But if the problem is continual exposure to LH, then that suprelorin implant, which we mentioned right at the beginning, which is a great option for males for reversible contraception, is also something that spayed females could get, and it would do the same thing. It's going to take LH and completely turn it off. So if
oh,
that's the problem, and again, that's one of the things Michelle Kutzler at Oregon State University and other places are looking at, and they've had some data that is seemed to be supportive of that, then giving a suprelorin implant will shut off that LH and hopefully, in theory, then reduce that risk of cancer.
okay, explain I misunderstood. So what is I can't say that for some reason. Suprelorin, did I
There
get
you
it?
go.
Like,
You said
okay.
it.
So how does it turn off the LH?
It turns it off because suprelorin is what's called a GnRH agonist, and that stands for gonadotropin releasing hormone. So the normal axis in a mammal's reproductive hormones is that there's a part in the brain called the hypothalamus that secretes GnRH. It goes a short journey to another part of the brain called the pituitary, and GnRH causes the pituitary to secrete two reproductive hormones called LH and FSH. And those hormones get into the bloodstream and go to the gonads. And in males, they support testicular function and testosterone production and sperm production. In females, FSH is named that because it stands for follicular stimulating hormone and it causes follicles to grow. And LH stands for luteinizing hormone, and that causes those follicles to ovulate and luteinize, which is
Mm,
what happens when they start producing progesterone instead of estrogen. So that's the normal route where it goes. Now, at each stage, those hormones have a positive effect, which is what I've just described that they do. And then they go back and they have a negative feedback effect on the brain and cause those hormones that are stimulating them to turn off. So it's not continual. Instead, it goes in cycles. So it's initial stimulatory and then it's a negative feedback. So what this GnRH agonist does, the suprelorin, is it releases a hormone from the little implant that's just like GnRH. And that goes to the pituitary and causes LH and FSH secretion initially. So there's initial surge in LH and FSH. But then the negative feedback comes back and turns it off. And because the implant is not in the brain, it's not in the hypothalamus, it's like under the skin and it's continually secreting this GnRH, it causes then the body to start doing this negative feedback all the time and completely shuts off the pituitary. So then the pituitary stops producing LH at all. And
so are
that's what
you
causes a male to be infertile because with no LH, there's no testosterone production.
okay.
And with the females, in theory, it would keep them from ovulating, but it has a stronger effect on LH, it seems like. And so they can get cystic ovaries in an intact female given suprelorin. Sometimes it causes that. So we don't love using it in intact females. But if the female's already spayed and there's no ovaries, nothing to become cystic, no ovarian tissue to become cystic. It just shuts off the LH, and that
So
could potentially help them.
Okay, this is fascinating. I did not understand that. So if somebody comes to you and they need to get, uh, they can't do an OSS with a golden, is that best practice? Are you recommending suprelorin in conjunction with a
Spay.
traditional spay?
Well, I w- we haven't gone so far as to recommend it, and that's because everything that I just said is at this point in
Theoretical.
theory because we haven't proven that the LH is the cause. It seems quite
Okay.
likely,
Okay.
but it hasn't been proven. And so for us to go out and just say, "Oh, we need to start giving suprelorin to all these females," that's kind of what my colleague Dr. Rabune from the oncology department at UC Davis is cautioning us against. Like, let's make sure we know what's going on and not taking this bit of information and then just running wild with it.
Okay.
And so we haven't been making that recommendation because we're still trying to figure out if that's actually what's going on. But I have had some clients come to me and say, look, I'm really worried about this. Is there any harm in doing the suprelorin? Well, no, if the female's already spayed, the harm I'm worried about is a follicular cyst in the ovary, but there's no ovaries. So if the female's already spayed, I'm not causing any harm by doing it. And I have done that for a few clients that have come to me with that concern, and we've talked about it. I just don't feel like I can in good conscience recommend it to everybody because I don't know for sure that this is exactly what's going on.
Mhm.
I think it's likely I'm not causing any harm. But there's also an ethical part for me. Like I'm selling this drug, and now I'm like, oh, I'm the doctor that's going to give this to you and sell this to everybody. And it might turn out that this isn't exactly what's going on.
Okay. That's so interesting, though. I mean, it's super exciting too, just to see how this unfolds.
Yeah.
Yeah. Right.
Here's a question that maybe you can speak to. There's a few people in the chat that have said, is there a specific place that they can go to access this type of information? Like, is there somewhere where you would recommend? Because sometimes, you have to hunt all over the internet to find something. Is there
Are they talking about like a
a
veterinarian?
veterinarian or advice on spay and neuter, advice
Okay.
on some of these things? Because there's tons of questions. I mean, we could
Well,
be
yeah,
here all
I
day.
would say if they want to read some reviews, then nowadays it's so easy to search these things. And I've given a couple names which can help to find the scientists and the veterinarians who are actually publishing this stuff. And they've written a number of reviews, and many of them are in completely understandable and accessible to the lay public, and you don't have to be veterinarians. So the Harts, HART from UC Davis, and Michelle Kutzler,
Z.
KUTZLER,
Okay,
um,
great.
out of Oregon State are two very good places to start and read. And if you want to read that paper on the that throws some questions, it's Rob Rebune, REBH, I think it's EUN, out of UC Davis. It has written that paper, and he's a well respected oncologist that has written on that.
And I'll just throw in, you guys, that Dr. Christensen does these webinars, and he has a whole backlog of them on the Kokopelli website, Kokopelli. But I'll send that to all of you too. And Dr. Kutzler it was fascinating. She did a fascinating 1 hour webinar on this LH loop, the negative feedback loop. But there's also, I think that's pretty understandable content. All those webinars on all sorts of different topics. Nutrition is really a great resource if you want to do a deep dive.
Okay.
Yeah, we've got a great resource there, and I've written some blog posts about some of this stuff too. So I
And
definitely
hopefully she's going to
wrote
do
about
stuff.
the males and the females and all that is and those are free. The webinars are $25, but
Yeah.
the blogs are free.
But they're really worth it. But also, I'm really trying to convince him to do a Substack. So maybe I'll be successful there.
Push,
See,
push,
that's
push.
You will. I'm just
yeah.
so many things.
All right.
Okay, did you want to do this one? I think we really
Um,
covered a lot of the questions on here as much
um,
as we can.
I think, like, another thing people are asking, I know that they really have a hard time finding vets that do OSS. Parsimus Foundation has a list. Do you know of anybody else who retains a list of where you can access a veterinarian who's experienced?
I don't. I guess I would just say two options that you could look at would be a good starting place besides what you've just mentioned is vets who are members of the Society for Theriogenology, or even better yet, like me, are diplomates of the American College of Theriogenologists. And so you can reach the Society for Theriogenology is therio.org. That's THERIO.org. And the specialists are theriogenology.org. So THERIOGENOLOGY, theriogenology.org. And both of those websites have search functions where you can search for veterinary members of each of those groups, and you can search by state. So you can plug in your state and find out, and you can plug in canine so that you don't get, the horse vets and the cow vets.
Yeah.
And that will pull up the names of all the vets and where they're at. It'll tell you their location so you can see if there's anybody close to you that offers reproductive services in general. And those vets are much more likely to be in tune to these issues than general practice veterinarians, which most of the time spend little to no time and interest in reproductive issues.
Okay.
All right.
Oh, I think we covered.
We
Did we
got
miss
through a
anything major?
lot. I don't think so. And I think
Oh,
we're
the one thing I did just see, maybe we'll finish on this one. Um, I had earlier asked about waiting until after the heat cycle, the first heat cycle, and you talked about for a traditional spay. But do you also recommend if someone's getting an OSS that they wait until after? No.
If they know they're going to get an OSS, then it's the same reason, the same thing I said about a vasectomy in a
vasectomy.
male.
Okay.
Yeah. Yeah. You're leaving the ovaries, which are the reason why we would wait, because you want them to have exposure to the reproductive hormones. The uterus does nothing by way of hormone production. It doesn't produce any hormones. So you could take the uterus out anytime, early, prepubertal, doesn't matter.
Hmm.
If you leave the ovaries, they're still going to go through puberty. They're still going to get all of those benefits of the hormones. So you could do that anytime.
Okay. All right. Great.
Okay.
Well, I can't thank you enough. I mean, that was really, really helpful. And I think you're going to help a lot of people make this decision because it's tough and it gets more complicated, it seems, as time goes on. So thank you.
Yeah, you're welcome. It was a pleasure.
Next time we'll get the lightning round questions for you.
Yeah, and I'm
Okay.
sure that there's a lot of people that are asking in the comments if you can come back, and they have more questions, and there's like a mountain of things that
Yeah,
people would like
I'm
to ask.
sure it is.
Happy
You
to
were
do it.
busy.
I was like,
Yeah.
we're not going to be able to get to half of
Yeah.
this.
Okay.
So,
All right. Thank you so
all
much. Go enjoy
right,
the rest of your day.
You're welcome. Enjoy your Memorial Day weekend.
you
Okay.
too.
Bye bye.